examples of individuals who have been heroes in their community in previous months. And we already asked this morning across social media channels for our followers to share their stories. So please keep them coming. If you're watching us on Twitter, and use the hashtag AskWHO. And if you're watching us on other platforms, please write your stories, share who is your hero in your community via comments section. Mike, Maria, good afternoon. Thank you for your time again. Before we receive more stories from viewers, we know as well that you've been inspiration to many people around the world, guiding us by science in this response, and helping us how to protect ourselves and our loved ones. But you're also human beings like all of us, and I'm sure that there are some low and hard moments for you in your daily life and jobs during this pandemic. How do you get up and keep going these days?
Well, thanks, Alex, for having us back again, and thanks for covering this topic. I mean, I think you're right. I think we talk a lot about the science and the evidence and the how we handle this pandemic. But as people, we're all going through this. I mean, we get up every day because we have jobs that we love. We have teams and people that we work with all over the world that, to me, I find incredibly inspiring every day, to put everything aside to try to help as many people as we can, as best as we can, as quickly as we can, as safely as we can. And I'm really inspired by that. I'm inspired by the fact that what we do does help people, and that people are surviving COVID, and that we are preventing infections. I am inspired by our member state briefings when we have countries present back to us how they have tackled this virus, how they have used the approach that we have outlined, their own experience. They've adapted it and tailored it to their context and situation, their capacities, their populations, their values, and made it work. And the fact that there are so many countries now that have shown us that they can control this virus, I'm inspired by that every day. I'm not going to lie. I mean, there are very hard days that we have, and there are days that are harder than others, but we're a team. So this gentleman right here, all of us that work together, I'm inspired by. So there's a lot that inspires me, and then I have to keep focused on to, get us through every day.
Yeah.
Dr. Mike Ryan.
There's a lot that inspires me. Well, you know what keeps me going? We've had a few rough days here. Maria's son, Cole, sent a number of months ago, and it was on a particularly tough weekend day, I think, and Maria arrived in, and she had these hand-painted posters, and there was a poster of a rainbow, hand-painted rainbow with "good job" written on it. So I've put that up in my office, and I see it from my desk, I see it from where I do the video conferences, so that's what makes my day. I usually look up at that little poster and say, okay, good job. Okay, someone thinks I'm doing a good job, so a shout out to Cole. Thank you, mate. I think for me, I think what drives me apart from the wonderful team we have here, but most of us, all of us, Maria, myself and others, we were once those frontline workers. I was that worker in a spacesuit and in a Ebola ward, struggling to find goggles and having, substandard gloves rip as you try to put them on, and knowing that your life depended on the quality of that gear. And worked in the field without therapies for Ebola. Now we have them, trying to convince people to get vaccinated against polio and trying to fight misinformation. So we've been those frontline workers, and I just feel that sense of personal responsibility that I want those workers to look up at us and know that we're doing our best. Not perfect. We're just doing our best every day to serve them. And I think that's probably the greatest stimulus to work hard. There's no other incentive. It's not about the pay. It's not about the job prospects. It really is that sense of response. And I think everyone in our program feels that sense of personal responsibility. I think the toughest thing for me personally is that I'm away from my family. I think I've seen my family once since Christmas, since I came back. And I won't see them again maybe till this Christmas again. So I really do miss my kids. I miss that social life at home. So I work and go home to an apartment by myself and then get up in the morning and come back to work. And I can understand what that sense of isolation people have and not having someone to talk to, although we're doing quite enough talking here, so I don't need to do any more. But no, I do miss my kids, and Katie and Sorka and Tom, if you're out there, I miss you kids. But it's the simple things. It's not the complex things. We all miss the same things. And we all feel that same sense of dislocation and strangeness with the way the world has gone and become, and hoping that things can get back to normal as quickly as possible, but knowing that they can't, because we have to face this thing. So yeah, it's difficult to explain, but I think this is basically what everyone's going through, you know.
I think everyone can relate to what we're saying, because we are all going through this together.
Mike, you just mentioned that you spent a lot of time in the field, and you led other outbreak responses. And as you just mentioned for yourself how you feel, and there are low moments for your team members, and sometimes even in conflict situations. How do you motivate your team when you see that outbreak is going maybe not in the direction that you would like to, and you're doing your best, but still there are more people being infected, more people being hospitalized? How do you, it's a hard job as well to motivate staff to keep going and helping others. I'm sure that this is a hard job now for many managers, not just in the response directly, but these are the new working conditions for many companies, businesses, organizations. So that it's a tough job.
Yeah, and it's the same when we heard the good advice that came out about lockdowns. Remember, we had a lot of people talking about staying active, having a plan, knowing what you're going to do every day, and knowing what you can do every day. Too often in life, we all do this in our personal lives too. You know, it's very hard to, you know, people tell you got to break down the problem, and then you got to do what you do today and do what you do tomorrow. And that sounds great until you're in the middle of a crisis in your life with the bank or, you know, whatever it is. And it's very hard to be rational. So the most important thing, certainly for me in an emergency response in the field, was to reflect and understand that people, our teams, sometimes they get scared. Sometimes they feel overwhelmed by the situation, by just what they're observing and witnessing, by the enormity of the cost if they fail, all of these things, and it weighs on everybody. You have to give people channels to let that out, create situations where that's not bottled in, but at the same time you can't allow that process to result in a loss of hope. You've got to, in some senses, let people express that sense of concern, because concern is real. Fear is normal, concern is normal, uncertainty is normal. They're normal human emotions. But you've got to try and translate that into a plan, into a sense of purpose, and a sense of being able to do today, what are we going to do today? And very often when things get really bad in the field, I tend to focus on the next, what are we going to do in the next 6 hours, the next 12 hours, the next 18 hours, the next day, the next 2 days, the next 5, and eventually you take back control of the situation. I think those people who work in the front line in emergencies and epidemics, in humanitarian settings, and many of the frontline responders, those brave firefighters around the world, particularly most recently in the US, fighting the fires in California, you know, they face the same uncertainties and the same sense of being overwhelmed, the same sense of dislocation, but they just get up and do it every day. So it's interesting that we all have that. It doesn't matter. Everyone has emergencies. I'm an emergency responder. I get the badge. But, you know, a mom trying to juggle 2 jobs and 3 kids and a sick husband, and God, that's an emergency responder, you know. And I think we're all in that sense emergency responders. And we just use the same human techniques that everybody else uses. And it's the same, I think, the one thing that you get through in the field or any emergency in your life is being connected to other people, having that shared sense of purpose, because there will be days when you're dragging the team along. And you know, there'll be days when they're dragging you along. There'll be days when you're not really making the big contribution. You're not the best person on the team. And a team brings everybody along, and it brings the community along with it. So they're the, I suppose, unwritten techniques. I don't know if you find these in any book anywhere, Alex, but that's what's got me through the day in emergencies, you know.
I think also, I mean, just to add to that, I think when you do work in teams and you do work in these kinds of situations, there are many times where it just feels completely overwhelming. I don't know what to do next. We don't know what the next step is. And I think, as you mentioned, Mike, like to let people acknowledge the fear, the uncertainty, to express it but then to sit together and say, what do we do next? What can we do next? Focus on the problem at hand as we understand it, because oftentimes you don't see the full extent of the problem. As an outbreak is unfolding and you don't know which way it's going, you don't know where you are in an outbreak. Because oftentimes when you get involved, you don't know in that epicurve. Now everybody knows what an epicurve is, right? Is it going up? Is it going down? Is it, how quickly is it? Where are you? So how do you, with the skill set that you have, because everybody has a skill set no matter what background you have, in any field, in any kind of situation, what can I bring to the table? And what is the next step? What do I do in the next hour? And how do we collectively as a group advance our knowledge of the situation to then reassess? And it's the team helps ground you when things feel like they're just out of control. The team grounds you, and your sense of purpose of what you know. Because when you're in an outbreak, you know what you want to get to. You know you want to bring it to an end. You know you want to prevent people from getting infected. You want to save as many lives as you can, minimize the impact. That's the goal, regardless of the situation. But your team will ground you into the foundations of what you know. And you hear Mike and I talk, and the DG talk a lot about the public health fundamentals. We are grounded in the fundamentals of what we know works, and that's why we repeat that a lot. But a lot of the times when any situation is overwhelmed, even in our own personal lives, it's just, what is the issue? What do we know about it? What can we do next? And then after we do that, what do we do next? Many people right now are in situations, I have friends, close friends, who have just been infected. What do I do? How do I handle this? How do I take care of my kids? My immediate family is not around. I'm thinking about this with my own family. If I were to get infected, if my husband were to get infected, we have 2 children. What is the plan? How do we think through these different things? And I'm sure everyone across the world is thinking about this right now. Or I have been infected. I've made it through. My loved one hasn't. All of these things we have to kind of think through. But it is a step-by-step approach. And when everything feels overwhelming, what is the next step? What is the next step that you can do?
Thank you very much. And I'm glad you gave these tips on how to plan and how to deal with different contexts and situations. However, this virus hasn't put us all just our health at risk. Some people are also facing existential crisis, losing their jobs. How can we help them as well?
Yeah,
What's the role we can play as all part of global community or in our neighborhoods, communities?
I mean, a lot of these outbreaks, everyone focuses first on health issues, but we know they go beyond health. And you've heard us speak a lot about an all of society, all of government approach, and the reason for that is because it isn't just a health issue. People are infected, and there is disease, and there is death. People recover, but it does have an impact on a lot of aspects of our lives. And so when there are plans that are in place, and if you look at pandemic preparedness plans, which were focused on flu before, a lot of that also discusses businesses and what to do there. In this type of situation, we've also had to think about businesses and how to keep businesses operating while a pandemic unfolds. And in many parts of the world and in many jobs, many people can work from home, but that's not true for all jobs. So there are many people who fill grocery stores. There are farmers. There are people who sell food. People who sell food for restaurants and hotels. And there's businesses that have to keep open. So it's finding that balance. But we need to governments and people need to be able to support those businesses as well. But there's ways that we can help too. You could buy local, for example. You know, there are many people who, if you can buy from a local shop that is open safely, wearing your mask and keeping your physical distance and using your hand hygiene, but buy local, that will help local businesses. In many parts of the world, restaurants are closed, but they can do takeout. You can buy that takeout. We've seen in a number of countries restaurants that haven't been able to sell food. They've donated or sold food to medical facilities. You know, there's lots of different creative ways that I think we can try to keep businesses going. And we're being inspired by all of the different ways people have found. But there does need to be support given to businesses that have been asked to close, for example, because we do recognize that the livelihoods, people's livelihoods are really at stake as well.
Yeah, I think, yes, I agree with everything that Maria said, but also we have to remember that the best way for us to get back to normal is to control this virus. We have to remember what's disrupting. It's not the economies were essentially broken before. Maybe in some parts of the world they were. But inequality, injustice, marginalization, racism, climate stress, internal displacement, migration, they all existed before COVID. COVID didn't invent these things. What COVID has done is really amplified and revealed and unveiled some of these deep-seated inequities in our society. The way we treat older people, the way we treat marginalized people, how insecure work is now, and people having to pay, not be able to get a fair losing the job, not because of the wages, but maybe because of the health insurance or something that goes with that job. So how indentured and how dependent people have become, and how most households now need 2 full incomes just to survive if you have kids. You know, so you can't afford to lose anything. There's no safety valve, there's no safety net. The lack of safety nets in countries, the lack of social systems that support people who are in trouble, all of that is being revealed and amplified by this disease. COVID itself is not necessarily causing that. And when we look at the responses to that, again, we've seen in Asian countries that with a comprehensive approach, with a really sustained public health focused approach, with the focus on community engagement and empowerment and involving the community, many countries have avoided the worst of this pandemic so far. It's not that they haven't suffered, they have suffered, but they've avoided the worst of it. They've kept things under control. We have to learn these lessons. We simply have to learn these lessons. One of the biggest reasons why this disease is continuing to spread is because contacts are not being identified or self-identifying and not staying at home for 14 days in quarantine. And that's exactly what drove the epidemic in other places. So I hate to bring it back to the science, because I feel desperately sorry for everyone who's affected. We are all affected by this, and especially those who risk losing their businesses or their jobs. Everybody is suffering. But I'm sorry to speak a hard truth. There is no way out of this right now, except letting this thing run wild and our hospitals become overwhelmed. We have the hope of a vaccine, but that is not a guarantee. So our best shot at this is to do better at trying to control this disease and ensure, too, that we keep our health systems up and running and protect our most vulnerable citizens. And that's the best way to protect the economy. That's the best way to get back to normal. And that means everybody, all of us, every single person, me included, we all have to look at our risk. We were here last week talking about our own building, and we were looking at the numbers going up in Switzerland. We were saying, okay, we have the number of people in this building this week. We should be increasing the number of people in this building, but we sent more people home because we wanted to reduce the risk. And we're modulating our behavior here according to that risk. And we may reduce it again next week, and then we'll bring people back again in 3 or 4 weeks' time. We're trying to manage our risk as individuals. We're having to do that too. We're not just having to lecture to the world about this. We're living this with you all in terms of our families, in terms of our workplace, our environment, and it isn't easy. So I think we have to do the 2 things. One is support people better, and governments need to do that. But at the same time, we all have the answer to this within our behavior. And that's a fact. And governments need to support communities and individuals to be able to behave. Because one thing is blaming people for not behaving, and the other is not enabling people to do the right thing. And too many people are in a position where they just cannot do the right thing because they're not in a position to do the right thing.
I just would like to share some stories of some people who share positive examples and how they supported their communities, or they know someone who supported, for those who are able to do something. So one example we received is that a sugarcane farmer in Mexico organized free meal delivery for elders and people in need. While my mom helped people who were jobless amid this pandemic and provided them with food. I'm working in prison since last 3 months, where many prisoners got COVID-19, and I'm taking care of them. I work as a volunteer in helpline during COVID. We at Delhi, India, are buying things from local vendors so as to help them financially. This is something, Maria, you mentioned, but I just felt acknowledging the stories that we received.
Please keep sending. Yes, please keep reading.
These are the real heroes. Get
Yes,
them online.
yes.
Interview them.
These are the real heroes and inspiration to all of us. And especially we're seeing in past few days and recently from some data on social media platforms that people are getting tired of being listening and hearing things about COVID, and that they are asking for something that is different, just to put their mind on a different subject. We understand that everyone is tired of the same, of listening again and again the same thing. On the other side, we see that there are more cases. We see that more people are hospitalized. We are getting into risk again of having health workers overwhelmed. So how do we balance these two different trends? On one side, that public and people are tired and they can't talk and listen anymore. On the other side, we have overwhelmed health systems and health workers, and we need to help them too.
I think both sides of that equation are incredibly important. But I think one of the things everyone should feel proud of is that we know so much more now than we did a few months ago. And what everyone is doing, whether you consciously know it or not, you have more information to have more power over this virus. And in many situations, in many parts of the world, people can take control over what they do every day and take the steps, the necessary steps, to prevent themselves from getting infected and to keep their loved ones safe. Now, that's not true everywhere, and there are certain situations where, the virus is really spreading and we don't know where the virus is. And that's the biggest challenge right now. If we don't know where the virus is circulating, you don't actually know what is risky or not. And that's why this approach that we talk about, all of these different things, the physical distancing, the hand hygiene, the respiratory etiquette, the wearing of the mask, avoiding crowded spaces, that needs to be part of everybody's daily routine. But one of the things, I would love everyone to think about is how do you become your own superhero? Be your own superhero in terms of, I can prevent myself from getting infected. Everything that I do today, I'm going to consciously think about this without letting it stop me, but it maybe make a little pause and think, do I need to go and do this activity or do I not? If I am exposed, I'm going to stay home. I'm going to find a way to be able to do that. I'm going to talk to my employer and stay home and contact my medical provider. I'm going to keep my family safe. There's lots of different things that we can do. Kids, can be helpful in this too. But this virus is consuming our minds. Make sure every day you find something that distracts you from this. Every day. I try to do this myself. I'm not very successful. So I should listen to myself. But listen to some music, read a book, play with your kids. Whatever it is that can bring you some joy, please try to find that joy. Call a loved one who's by themselves, ask how they're doing. And I can't remember who said to me once, always ask twice how someone is doing. Ask the first time and listen to a response, and ask again, how are you doing? And have a conversation. Those are the types of things I think that can help us distract us from this every single day. But we know a lot more now, and I'm hopeful that some of the noise and the misinformation that's out there that is really damaging, people at least know, I don't need to pay attention to that. I know these are the things I need to do every day.
Thank you, Maria.
Yeah, and I think it is confusing for people because there are restrictions and then lockdowns and they're national and they're sub-national and there's these binary principles of it's mask, no masks, or it's hand washing, no hand washing, and people get confused between what sometimes look like scientific arguments and then they become political footballs, and then people don't understand, is this a political issue, is this a health issue? And it's not easy. And I honestly don't think we've served the public well in this. And I think everyone, governments, public health authorities around the world, need to step back and take a look at how we're communicating with people. And I don't think there's top marks there, and I think we can do better. But equally, ordinary people, at the end of the day, a virus is a microscopic piece of essentially genetic material surrounded by a little bit of protein. It has no capacity to live on its own. The difference between a virus and a bacterium or other microorganisms is those microorganisms like bacteria, like ourselves, we can live without reference to another biologic entity. In other words, we can live by ourselves. A virus must occupy a human host in order to live. It requires the human host to reproduce. And therefore, the virus has to find a way to get from me to you, and from you to Maria, and from Maria to somewhere else. It has got to jump. And it's got to jump quickly because it dies. It cannot survive in the body for a very long time. Not this one cannot anyway, thankfully, survive in the body for a very long time. Therefore, you need to think, how do I make sure, if I'm not someone who's had the disease, how do I make sure today, not tomorrow, today, how do I make sure I don't get COVID-19? And if I have the disease, or I think I have it, how do I make sure today that I do not give this to somebody else? And if you break it down for that, and you do everything today to stop getting the disease or giving it to someone, and then you wake up tomorrow morning and you start all over again. It's not about long-term stuff. It's not about the guidelines next week, and it's not about level 5 and 10 and level 15 and this, that, and the other. It's about people being able to make good decisions. And if enough people make good decisions, this disease comes under control. The tough thing about making good decisions is that it's hard to make a good decision without good information. Yeah. It's hard to make a good decision without support sometimes, to make that good decision, to implement it. You can make a decision, but it's very hard to implement unless you have the support. So for me, that's what it comes down to. And it sounds terribly simplistic. But imagine if every person on this planet got out of bed tomorrow and decided, I'm going to do everything I can today to stop this disease transmitting from me to someone else or from someone else to me. And you keep doing that for 14 days or 21 days, this disease doesn't survive. It's incapable of surviving outside the human body in that sense, except for short periods of time on environmental surfaces. It would go away. Now, that is very difficult to achieve. And I don't think we can necessarily achieve that in the near term. We may need a vaccine to help us finish this virus. But other countries have shown it is possible to get this virus down to a level that is perfectly compatible with normal living, as we understand that. So maybe we just need to create, maybe that's where young people, we need a new, maybe we've screwed it up and we need the young people to get together and say, we'll do it, Let's let it, we'll show you, because it is about behavior in the end. It's not about technology. It is about behavior. Our collective behavior and what we do as individuals in our communities. That is what's driving this pandemic. And governments and ourselves and others and public health authorities need to do better in supporting communities to get rid of this disease. Not in wagging fingers at communities and telling people what they're doing wrong. It doesn't help. It really doesn't help. We have got to support communities through this. And we're going into a tough phase now, probably in Europe and in North America and Canada, the Northern Hemisphere in general. But parts of the Southern Hemisphere are still struggling. So this idea that the disease has moved to the Northern Hemisphere and now we're going to have, there's still countries like Argentina and others that are still, struggling and having a tough time. So this disease is unpredictable. Everything we predicted, in a sense, it's going to be, remember the flu season in the Southern Hemisphere is going to be severe. It wasn't. And then COVID wasn't severe. And now there are countries in the southern hemisphere who are going into their spring, and they have very, very high numbers of disease. And this disease hit much earlier in the autumn than anyone would have suspected if you compare it to influenza. So there are lots of things that are very unpredictable about this virus. And there are lots of things, well, I agree with you, Maria, there's lots of things we know, but there's still lots of things we don't.
Can I just add something? I think two things. One is in the countries that have brought it under control. I mean, incredible amount of work, incredible focus on what needs to be done. Keep it up. Don't let your guard down. Follow through this down period and keep it low. I think one of the things we worry about, and many countries worry about, is, and many countries have done, is they've brought it down to a low level and then they've lifted up too quickly, or they've lifted up and thought we've made it through and it's resurged. There's no reason there has to be a resurgence. The virus needs people, as we keep saying. They need people to pass between. So if it is low, it can stay low. So please, please, please keep it up. And that involves all of you that are watching in countries where it has all of the decisions that you make. This is my second point. As I think all of us are making sacrifices right now. We're all making sacrifices into what we used to be able to do. Mike hasn't seen his family. He's seen his family once this year. I was away from mine for 2 months where I self-isolated from my family because I was worried about bringing the virus home in the springtime, and that was incredibly challenging for me. I have a really little baby and an almost 10-year-old Cole. Hi, Cole. And, there are sacrifices that we need to make, but that includes things like, not having that dinner party at your house, having a different type of birthday party for your kids as opposed to bringing people together. It's avoiding those small gatherings. We see in the Northern Hemisphere right now, a lot of the transmission is happening in the home, people bringing it home, having small gatherings at the home, social types of entertainment and industries. But having said that, how do we support local businesses while keeping ourselves safe? So we have to find the balance to be able to do this. But this will require sacrifices for us. For my family, it means we haven't been able to travel home, this whole year. And we travel home maybe once a year, maybe twice a year if we're lucky. But that's a decision, it's a conscious decision that we have made. Our family hasn't come over to see us either. We haven't been going out to dinner. We haven't been, having people up. There are little things that we can do. And I think all of us need to continue to do those little things and find other ways to be socially connected with our friends and our families and our loved ones, and looking out for our kids, because this is really difficult for our kids as well. Different age groups, it has a different type of impact, whether they're older children, teenagers that have a good, strong social structure. This is very challenging to not be able to see their friends. How can they continue to see their friends? For the littler ones, it's a little bit different because they don't yet have that kind of friend connection. But I do think we need to be honest that all of us must continue to make these sacrifices for the greater good. And I think that's part of our own power that we can have in combating this together.
Thank you, Bob. I would like to read a comment we received from Maggie Federico. The idea of spending another winter without seeing family and grandchildren is daunting, especially when you are in your late 70s. You wonder whether you will get to the other side. And with your kids, you have to pretend that all is well, that they need not to worry about you. They have enough problems trying to work and keep their kids in school. Thanks so much for what you are doing. Much appreciated.
I mean, that's motivation. I mean, everything Maggie has just said, so many people across the world feel, and I think that, to me, is one of the strongest motivations that I have, and I know many people have, of having my kids be able to see their grandparents and hug their grandparents. And it's that, I mean, that's what, gets me the most, I have to say, the ability to hug our family members and the little ones. And I know that there are many older people who are worried that they won't be able to see their loved ones again. So the quickest way we can get back to having our grandchildren hug their grandparents is to control this virus. It is to control this virus. And if we can collectively come together and have this unified front of tackling this together, apply the tools that countries have at hand right now, focus on this really for the next few months, like focus on what we can actually do. All of us coming together to do this at the same time, even in countries that have brought it under control. We can get Maggie's grandkids back into her arms again. And that's whatever motivates you.
Yep. I mean, if you were to actually calculate the price of a hug, if you asked every person who hasn't hugged their kids, or more importantly, grandparents who haven't hugged their grandkids for 10 months now, if you asked them what they would pay, what they would give just to hug their grandkids, I mean, that to me is one of the greatest sacrifices of all the sacrifices that have been made. So, Maggie, you're a hero, and so many other people like you are in that situation. It is it's a daunting prospect. And we need to get creative, I think, and more creative in how we can do something about that. My own mum is 80 years old, or 80 years young, and she's, she doesn't get to see her grandkids either. She lives on her own. I guarantee you that's the greatest thing for her too, is just to have that hug, and the meaning of that and what it means to people. So, and it's the same for parents and their kids who can't see each other and meet each other. So no, it's really tough, and it is true. And in the later years in life, people worry. I know that I've seen in the past when grandparents, knowing when you were leaving your grandparents' house. I know when my grandparents were close to very, very old, I knew every time I left them that I might never see them again. And as people get older, that's what they begin to think, will I ever see them again? And for an older person, that's a real concern. It's not next week. It's not the week after next. It could be next year. Literally next year before some grandparents get to hug their grandkids. That's a really long time. So, I mean, it's hard to express my own emotion on it because it really gets me. All I can say, it'll spur us on to work even harder, because they're the real prizes, aren't they? The hugs.
The hugs. We all love the hugs.
Yeah.
The hugs.
Yeah. Yes.
Especially when we feel sad and when we go through a difficult time, all you need is to go home and get a hug.
And when you're happy and celebrate that
Exactly.
happy time. I know we were trying to be hopeful here, weren't we?
I'm actually feeling good now. I'm thinking about hugs. It's great. But the human connection is a very special thing.
It is.
I remember in Ebola outbreaks in the beginning, and we had a very medicalized approach, and it was necessary because we felt we had to isolate people. And one of the things we didn't really consider enough is that we were taking people away from their families into isolation facilities where there was a 70 to 80% chance they would never leave that facility. In Ebola, before we had treatments, before we had vaccines. And we didn't realize we were taking people away, young people away from their families, and we didn't really think about that human connection. And then we wondered afterwards why communities didn't trust us, why communities didn't trust the treatment centres. Why would you trust the treatment centre? 8 out of 10 people die. We thought we felt we were breaking the chains of transmission, and we were. But what we didn't understand is the impact that was having on the social fabric and on the families. And that backfired many, many times. And we've learned through community engagement and dialogue to understand how to do it better and how not to make those mistakes. And there are many NGOs and others out there who really champion that. So for my...
This is different now, right?
Very, very different. But it's like in this event, it's just the stakes are high for communities and for older people particularly.
On a positive note, I really want to read next story that is inspiring. One of our colleagues took a break and had 2 hips replaced. He's back driving the ambulance. He's 85 years old and wonderful at his job. He redefines what it means to age and to give of yourself with bravery.
Wow.
I mean, honestly, those are the things you were asking us at the beginning of, like,
the amount of self-pity around this table is amazing compared to that.
But just the drive that people have to want to do things. I mean, one of the things I've been inspired by all of the different stories that I've seen, and knowing that this was the topic today, I was doing a few searches and just looking at different things online, And there are a lot of websites are about stories of hope and resilience. And I think people should take a look at those. You know, if you're doing there's a lot of bad stuff on the web, but like look for stories of hope and resilience. And I was looking through a few of them, and there's some stories about refugees and migrants who've supported the response in various ways. You know, they've come forward if they have medical qualifications, offering skills as healthcare workers, such as nurses, doctors, clinical assistants, offering help in essential services that cannot be interrupted, such as hospital cleaning and rubbish collection, assisting as cultural mediators and translators, and disseminating really critical information and health messages to different populations, making face masks, producing face masks, protective gear, soaps, and other cleaning products, volunteering to help the most vulnerable members of communities, such as older people, shopping for groceries, picking up medicines, creating art and music that promotes hope and solidarity and awareness, sharing strategies and information on how to remain helpful at home. There's so many. You know, joining contact tracing teams, assisting on the helplines, you mentioned that earlier, doing deliveries during lockdowns. You know, the face masks, making fabric face masks I've seen all over the world, which is really incredible. The show of these colorful protection, you know, of part of this pandemic has been really wonderful. When I was in China in February, I'm sure I've told this story before, but when I was in China in February, when we were going around the different cities and we were learning about the response in China, one of the things I was most touched at were the care packages that were being given to families who were in quarantine. And within those packages, there was food, there was medicines, there were masks and disinfectant products, but there was also a plant. And in families that had kids, they put in coloring books. And like the personalized touch of not just putting together something, and there was a personalized thought that someone had to say, I know you're going through something tough. I know people now who are in quarantine, and people are delivering food to their house, and they're saying, how can I help? Every question that someone asks every day of how can I help will make us get through this pandemic quicker. And it will make us get through this together and feel like we are part of this. But it's just wonderful. One of the quotes from one of the websites I saw was, and I didn't get the name, we cannot afford to be selfish. We need to be kind to each other and show empathy at this difficult time that the whole world is going through. I mean, those are the types of things that I think people can connect to and feel like, I'm not alone. I may be physically alone, but I'm not alone in this. And no matter how deep despair we get in, there are lots of things that people can do. Some people have used their time at home in these stay-at-home measures. Those who feel safe at home, and we should recognize that not everybody is safe at home, but those that felt safe at home have enjoyed the time with theard families. We've heard these wonderful stories about dads spending more time with their kids than they did previously. People picking up a hobby or catching up on things at home, or some people saying, I've learned to dance, or I've learned to play the piano, or whatever it may be. Those are the types of things that are, whatever works for you to help you kind of get through this. But there are wonderful examples online. And I hope, Alex, that people will continue to send these in and send videos. Please, you know, we get a lot of not so nice social media messages sometimes.
Well, there are many nice now. I'll read it at the end.
I hope so, because
This has always been good at this.
we need to balance that. Yeah.
Some of the stuff we get
There's a lot of stuff, and I would hope someone out there who's thinking about not sending a nice message to just think twice, because it matters, because we see those and it affects us. So please don't. But send the positive ones and send videos and tell us stories, and we need it.
Maybe this question is for you because you have small kids. Can you please post lots of suggestions, maybe share some, about how to safely let the kids trick-or-treat this Halloween?
Ooh, that's a great one. I am not an expert on all kids. I'm just a mom. You know, I happen to work at WHO, and I happen. No, I'm doing my best. But Halloween is a big holiday in the United States, where I'm from. It's picked up a little bit in Europe, although it depends on the country. It's not as huge in Europe. I don't know how much Halloween is practiced around the world. But there are ways that Halloween can be done safely. First of all, depends on where you live. And so Halloween activities take place outside, which is better than indoor activities. So keep the activities outside, bundle up if you're in colder areas. Make sure you stay distant, so stick with your family, your immediate family, and try not to do it in bundles of other children and other families. Keep that separation. There's ways that you can approach, houses and pick up the candy. 1 piece of candy per household, please. And then use disinfectant, the hand hygiene and all that kind of stuff. And a lot of Halloween costumes have masks. So I don't know, we have not done any studies on looking at Halloween masks and protection or source control, but I think there's ways that Halloween can happen, but it really depends on where you live, and it depends on how much virus is circulating. But please do it as individual families and try to make sure that you don't congregate. I mean, because the virus does need people to transmit between, so if you can avoid those crowded situations. But I think US CDC has guidelines out on trick-or-treating. So I would advise you to check the US CDC website on that.
Thank you very much, Maria. We've received a lot of positive comments on this conversation today, and I just want to read some because it's about frontline workers. Thank you, WHO, Dr. Tedros, Dr. Mike Ryan, Dr. Maria Van Kerkhove, for recognizing the process we all feel being on the front line. Having a shared sense of purpose through uncertainty, loss, and concerns keeps my team strong. So just to share some of thoughts of your colleagues, and as well, many health workers have been working long hours. Some of them have got infected, bring the virus home. And here is one story of support to a health worker who got infected. My sister and her friends brought me 25 plus prepared meals to my door when myself and my 2 kids were infected with COVID. I'm a health worker. It made it easier to rest, observe strict quarantine, and break the chain. I'll never forget this. So speaking of your invitation, extending the invitation to our viewers to share their stories and to be kind to each other and supportive to each other, I think especially to health workers who are saving our lives and our loved ones, we need to be maybe extra supportive of, because extra thankful, extra grateful, support their families as they don't spend much time at home. And
I wonder, I don't know if you put, when you asked for this, if you created a hashtag on this, but maybe we can create one. And I keep thinking of our, be observant, be vigilant, be wise, be alert, be sure. Maybe need one of be inspired, be helpful.
Be helpful.
We
can use be helpful, and we can invite all our viewers to share more of their stories in coming days and throughout this. Maybe before we close, here are a few comments. Such an excellent conversation. Thank you, guys. You are great, Maria. Thank you to the team that does this regular info broadcast. So I would like to give a shout out to our audiovisual colleagues who are supporting us every time behind the scenes. It's a voice of sanity in a sometimes hysterical world. Thank your families from me for their sacrifice, which is so helpful to us. So thank you, everyone, for your kind words, your inspirational stories and actions, and helping us to stop this virus from spreading. Do you have any final words for our viewers, how to be their own heroes and how to be helpful?
I'm looking forward to more examples. Every example that you provide is another example that somebody else can use. So the sharing, the collective experience, but be helpful, be inspired, be safe. And I don't know how we can turn this be your own superhero into. I'm working on it, but I think we need people to feel like they are their own superhero, and they have that power to protect themselves and others, and that that could be infectious. That's what we need to spread.
Yeah, I think what I've learned in emergencies, any kind of stressful situation, and I've been through lots of different situations, hostage situations and other stuff. And certainly in my experience, it's focusing on what you can do, not focusing on what you can't control. When you're a hostage, you can't control certain things. You're not in control. And you have to learn how to create control over even the smallest things. When I eat, when I stand, when I exercise, when I look out the window, when I do whatever. And the more you can establish the do's in your life, as opposed to the don'ts. And too often over the last few months, people have been saying don't go to the bar, don't do this, don't go to church, don't. And the don'ts become, no matter how reasonable a person you are, after a while you just go, shut up already, stop telling me what I can't do, right? And certainly in a stressful and an emergency situation, everyone having a job to do, everyone feeling part of that process, everyone feeling part of that team that's making a difference. Not spectators watching other people be the heroes, but participants participating in the hero's journey. And I think the more you can get out of bed and think, what can I do in the next hour and the next day to protect myself and protect others? What can I contribute? And let's maybe for a little while stop thinking about the don'ts and start thinking about the do's. Maybe we'll do a little better.
Thank you very much for this conversation. Be safe, be kind, be helpful. Better days will come. They will. And I would invite you to go back to the recent event we had on mental health and how to cope during this crisis, and support we received from Super M band and their song Better Days. It's very inspirational and helpful when we need to find some positive words and positive melodies. Until next Wednesday, thank you everyone watching us from all over the world. Goodbye.